Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. And let's talk about this pandemic. In this video, the year in review. What lessons can we carry forward? And stay with me till the end because I think it's now possible we can put some metrics around what the end of the pandemic might look like. So please share this video with someone you care about. And I'd also like to welcome my buddies who've been with me so long through most of this year. In Haywood County and Western North Carolina, it's now been a year since we all perked up to the realization that this new virus was something we needed to prepare for. And in the first few months, there were so many unanswerable questions. Is this any different from the flu? What works and what doesn't to prevent and treat it? Will it go away in the summer? Well, we now know the answers to many of those. More than 500,000 deaths later, an estimated 1 out of every 3 people infected with prolonged symptoms for weeks and months. Latinx and African Americans disproportionately affected, the agony of people dying alone and families suffering because they could not be there, the agony of healthcare workers overwhelmed in circumstances no one had ever faced. We've learned better how to treat this, and yet those severely affected continue to die. You'd have to ignore the reality to still believe COVID-19 is just like the flu. In Haywood County in Western North Carolina, the virus took its time getting here, but once here, we suffered plenty, even if less so than many other places. We learned how Swiss cheese can limit spread, combining all the protective public health practices that together work. Limiting exposure through distancing and avoiding high-risk situations work. Face coverings work. Isolating if sick and quarantining if exposed. It works. But there was a toll. Being separate from extended family, businesses suffering, trying to balance home and work. And we learned how woefully inadequate we as a country were prepared. Not enough PPE, not enough ventilators, and sometimes not enough space or people to care for people. And so many having difficulty recognizing how to balance their individual concerns with the impact their choices had and have on the well-being of others. Ironic, because in their zeal to protect themselves and their loved ones, so many of those choices actually prolong the agony. And yet, here and around the country, we also saw many people devote their energy to adapt, to find creative ways to make the best of a situation no one wanted to be in, to support those around them. And going forward, here is the big takeaway. You can see here the graph of cases in the country, and next to it for Haywood County. And notice there have been rolling waves of surges, as was predicted by many early on. We avoided the first one here. The first cases in the U.S. were identified in late January and in Haywood County in late April. But note also, there is about 2.5 months between when cases emerged and the first spike happened. And then once the cases returned to baseline, another 2.5 months before the next surge. And also note that after each surge, we did not return to the previous baseline. And so the next surge started from a higher level and went even higher. Each time, inadequate attention and commitment to driving the cases to a previous or even lower baseline, too eager to open up too soon, and now so many places dropping restrictions, again too soon, because each time an even higher level of cases, hospitalizations, and deaths is what we saw. Now, some other countries, people did make the commitment, and some of those places are now not having to live under the shadow of this virus, but we're not one of them. And if we are now about at a new baseline, and if the pattern continues, then we can expect a surge in 2.5 months, about mid to late May. Right now, cases are lower, thank goodness, but they are not low. We are still above the baseline that was present before the winter surge. How high will the next surge go? New variants of the virus, our behaviors over the upcoming Easter and spring break holidays. If people do not honor that it takes from 4 to 6 weeks after the first vaccination dose to get the full effect, depending on which vaccine. And in the meantime, risk has not gone away. All these threaten our ability to truly get out from under the shadow of this virus. On the other hand, more of us getting vaccinated, committing to the public health protective measures until the coast is truly clear, these give us hope for this summer and fall to get out from under this virus. And that's just a couple of months away now. By the way, deaths among those first vaccinated back in December, the long-term care facility residents, have now dropped significantly. These vaccines do work. So here are some metrics to define when the coast is truly clear. Less than 100 deaths per day in the country, less than 2 in North Carolina. Less than 5,000 new cases per day in the country, less than 100 in North Carolina, less than 2 to 3 in Haywood County. You can see where we are. We're closer than ever. So it can happen, and soon. But as has been true all along, it depends on what you choose to do, what those around us choose to do, and what we as a community choose to do. So be well and be careful, especially right now.